Good afternoon. And today I have pleasure of interviewing Colby Mamigonian. He is a physical therapist, PRI-trained, and we're going to learn a lot of new things about Hakomi method, Biotensegrity. So good afternoon, Colby.
Good afternoon. Thank you for having me.
And today, in a deep conversation with Colby, we're going to talk about connection between posture, breathing, dental health, and because Colby is PRI trained and I'm so passionate about this technique, what I include in my book, Breathless, I have a whole chapter devoted to connection between head and a body. How funny that sounds, but not a lot of people are aware about that. And we're going to talk about why orthodontic treatment can fail without addressing the body. Because when we move the teeth, we fundamentally change a lot of things. And what dentists must understand about night guards, retainers, and airway-driven dysfunction, and physical therapists have to understand that too. We have to speak the same language. So my first question to you, we put a lot of wonderful alphabet on a screen, and yes, I promised to talk about your bio. Yes. But you were trained, you're originally from New Hampshire, but now you're in Brooklyn, New York, and you see your patients and you help them breathe and function better through body and connection, body with psychotherapy, yes. The somatic and physical health, the mental and physical health. So that's all very interesting, but I want you to give us a little history, how from regular physical therapist with the stretch and all of that, you learn or you lean towards Hakomi method, Biotensegrity, and PRI.
Sure. So I originally, after university, was working in the sports world, particularly tennis. I had a passion for tennis. And I thought, man, it would be really cool to be like the fitness trainer or the physio to a Roger Federer or something. And so I spent some time in that world down in Florida working with juniors and pros, and then found my way to New York at John McEnroe Tennis Academy. And at the time, my father had experienced an aneurysm in his brain. And so I was seeing the rehab he was exposed to. I was seeing somebody who had a neurological injury. And also, I'm always curious and I'll hear about different things. And I was hearing about PRI, Postural Restoration. And I was reading some articles about it and seemed interesting, and they kept talking about this postural pattern of a right shoulder that's lower and a rib cage that's twisted, and so I was like, oh, that's interesting. And then all of a sudden the top junior female tennis player in the country came to the academy to work with John McEnroe, and she was experiencing some physical issues. And they brought her in to work with me, and she walked in, and I was like, that's what PRI is talking about. Very, scoliosis, right shoulder, the whole 9 yards. And so that pushed me to take my first course to figure out how can I help this person, because they're talking about what she's presenting with. And so that led me down taking every PRI course and learning about the relationships between the pelvis, the spine, the rib cage, the neck, the cranium, the jaw. And it was the first method that I learned about that emphasized sensation. So how does their brain sense their body, and the conversation of what they sense and what they don't sense drives how they position their body in space and how they move through space. And then I got to a point where I was having some of my own physical issues and pain and tension. And I said, I think I need to go out to Nebraska to experience working with the founder of this, Ron Hruska.
Dr. Ron Hruska,
Yeah.
he was on my channel, and I find I learned so much, and a lot of people learn. His interview is very popular.
Yes. And so I flew out and I went through they call it their Prime program. So you go out and you worked, this was back when he was practicing. So you would work with him, his optometrist, and then you would get a appliance if they so feel you need it, maybe some orthotics for your feet. And so if I fast forward, I made a few trips out there over the course of 2 years. And every time I left, through a combination of the first time I got some prism lenses, I got a mandibular appliance, I got orthotics. The next time they recalibrated the appliance, I didn't need the glasses anymore. I would get a technique or two. Every time I would leave, I would feel like $1 million, like all of the tension in my body was gone. And then I get back to my normal life, and over the course of weeks, maybe a couple months, I wouldn't go back to the body that I had before. Right? My symptoms would have improved, but I would kind of lose a little bit of that progress.
Why?
Well, I wanted to continue to dig and figure out, why is this happening? And I had a mentor at the time that turned me on to the importance of psychology and emotional processing. And what I found was, in certain sessions with my therapist, and I was lucky enough to find a really good one, when I would be processing very emotionally charged memories from early on in life, and now I had a therapist to help me feel and process those emotions, I would feel in real time my cranium and my body shift back towards what Ron had gotten me to with the appliance and so what I found was that there was an autonomic nervous system component to this that was obviously, the physical body was contributing to some of that, but it was also emotional and psychological. And so that's what's led me to be studying the Hakomi method, which is getting a better appreciation of how me as a therapist, as a movement practitioner, my state of mind and my ability to regulate my own emotions influences the person I'm trying to work with on how they regulate their own emotions.
I love it. I love it. It's basically, I just want to say for my audience, we always exchange energy. I exchange energy constantly with my patients. They not only get better from, specific action I do, but from, my positive approach to life.
Yes.
I do have that, and I want them to feel that. But yes, it's going to be better and better. You're talking about that kind of thing. So in a way, in a state your practitioner is in.
Yes.
That really affect you. And it's different for different people, because certain people need vitamin C and certain people need vitamin D and certain people need vitamin E. And yes, we're all different, but you need to be able to recognize what specific mix of emotions you need.
Correct. I just was out at the Postural Restoration annual symposium, and I presented for the second time out there, and it was on this. It was talking about how when we are very young, in that first year or two, that's when our autonomic nervous system is developing, and that's when we learn how to regulate that autonomic nervous system.
Oh, yes. And the state of mind of parents is so important. That's why anxious parents produce anxious kids.
Yes. And that that same process is carried through all of your life, and you can work on it as an adult. And so what I found was a lot of people that would find their way to me, they would be presenting with all of these body issues, but the more I learned about the autonomic state and the right brain emotional state, I started to associate or build these correlations between their ability or lack thereof to regulate their emotions and the physical patterns.
Oh, yes.
And that if I improved my ability to be calm and present, that's a huge part of this, being present. And I can be an antenna of picking up what they're experiencing, and I can help a lot of times non-verbally, just with my state of mind and my presence. I can help calm that nervous system so that the interventions that we're trying to do can stick longer, and that when I send them off back home, they've had an experience with me where they're in a calmer state, sensing and feeling their body in a new way, so that they know when they go home what they're trying to feel when they're on their own. What was that thing? What was that experience I had with Colby? What did that feel like? And now can I go home
And feel the same.
Exactly. Yes.
I have a question, specific questions. Hakomi method, why they accentuate right brain so much?
Yes. So the right hemisphere of our brain it's the first to develop in life. And it's the hemisphere that is our emotional processing hemisphere. It's also the hemisphere that has the strongest and oldest and deepest ties to our embodied sense of what's going on inside of us. And it's the hemisphere that regulates the autonomic nervous system. Now, the left hemisphere, which is the analytical side, the side that can take information from the right and kind of dissect it out and look at bits and pieces, and that side is the side that modern culture overly emphasizes. We are living in a culture that is so left-brain-centric. Everything with our social media, the way we obtain information, the way our school system works, it's all here.
Yes.
And it takes us out of the right. So what Hakomi has appreciation of is that when we are with another human being and we can enter the present moment and get into a state of mindfulness and share the emotions, which are the feelings of what, it's a way into the right hemisphere. And so it's a way into the present moment. And there's a tenet of my work that I try to teach everybody, which is the only way you can heal is through the present moment.
I love it. I really hope people who listen to this program, and it's going to be information about Colby Mamigonian, and he's going to be on my book events, and
Yes.
you can really experience his presence, but also learn from him, and maybe use the help what he can offer. But this is also beautiful and deep, and I really love it. I actually had another, your theory or Hakomi method remind me the another interview I had on my channel, which also has 1,500 views from Jill Bolte Taylor. That's the person, the most popular TED Talk in the history, because she studied her stroke.
Yes.
And then she wrote the book about exactly what you're talking about, left hemisphere, how it's predominant now, and connect with ourselves, and how we have to have meetings with the little people who live inside those hemispheres, and that's going to help us fight insomnia, or find solutions in life, which also really beautiful. But I want couple things before we finish the interview to accentuate for my audience. And one of them, working with the guards and dentists on creating, state of balance. And I really want to bring to my audience that specific question what you ask me personally. Why sometimes when people wear the guards, they develop spaces between the teeth? I think that's very important because some people say, yes, Colby, you recommend me the guard. Dentists who trained PRI-trained made me the guard, but now I have spaces from the guard. I want to rectify that because it can affect some people. Yeah. So just for people to know, sometimes guards made with a clasp, with the metal hugging lines to stay on the teeth, we can make guard inside very loose to prevent any pressure, because people don't like to be embraced in a guard, so we can make it very loose, but in two spots we can have this metal lines what's gonna keep the guard on the teeth. But if you have this autonomic nervous system regulation and tensions, and you're going to continue to express them or to control them through the clenching, those lines going to press on the spaces between the teeth and you will develop a spaces. It's nothing scary about that. It can be done, not relieving the guard so much, not making clasps so tight what they hold the guard. It can be done different ways. And if you stop wearing the guard or change the design of the guard, they most likely gonna close, because good news, teeth move through the lifetime. Depends on the body position and balance. Yeah. So my question to you, we talk about Hakomi method. Now I want to ask you about this sophisticated word, what I love, and I do work with the fascia, on my level, and I can talk about that. What does it mean, biotensegrity? If I would have a dog, my dog is actually here. She has a name, Sage, like wisdom, but I can call her biotensegrity. I love the music of that word.
Okay, so this was, I found biotensegrity as another explanation for why certain things don't stick. And also it became a model or a template for how I view the body. So I'll be as brief as I can. So traditional anatomy and biomechanics is over 400 years old in its origin. And it began with an anatomist back in the 1600s who started dissecting bodies and making arbitrary incisions and trying to remove, quote unquote, parts from the body. So he would see where this tissue that looks reddish, where it starts turning white, and he would cut there. And so he started removing muscles and bones, and he kind of just threw away fascia. And then he decided, well, then how does this work? And he looked at machines of the day, so pulleys and levers and this and that, as a means to come up with a model of how to put it back together. And so then we were found muscle goes from here to here, and when it contracts, it pulls this. And well, for the last 60 years at least, we've had an alternative model, which is called biotensegrity, which at this point, there are cellular biologists at Harvard that research and produce papers backing this up. There's anatomists across the board. In a classic structure, you have parts and they pass load off directly. So you stack hard things on top of hard things, and it's all compression based. In a tensegrity, you have compression elements and tension elements, and the tension keeps the compression suspended. It is automatically, inherently space filling. It balances and distributes forces. And people sometimes, by the way, look at this and they're like, well, that's not in the body. It's a model that shows you how energy and force is balanced. And essentially, it's a duality of forces, duality of things that are pulling together and things that are pushing apart. And because we're not static, that's always changing. But one of the lessons we can glean from biotensegrity is that the body's one continuous network, and when it's balanced, it distributes energy around evenly. And when it's balanced, it likes to fill space.
Oh, yes.
Now, just look what I just did. That is what we're trying to do with a palate, with a cranium. That's what I'm trying to do with the whole body, is getting the tension to be distributed in the body, the palate, the cranium to be able to expand, and there not to be accumulated tensions.
Like most of the modern human beings do.
Correct. So we can look at these models, come up with a better idea of how the body behaves. I mean, I lecture on this. This is a long conversation, but I'm just giving you little points. And so the breath, this is why the breath is so important. The breath is a way to distribute tension. The breath is an inherent mechanism from the inside out that can open the body in 360 degrees. A lot of the people who find us, that's not going on.
No, I would say, that I treat sleep apnea, so all my patients don't distribute it evenly.
No.
They distribute it in one little place right here, and then they wonder how come the bone grows inside, how come the headache and tension constantly, how come they grind, and pelvic floor is totally not movable.
Yes. I like to tell people, give this little two images, right? The breath that we want, which if you just look at a healthy baby, this is how they breathe, right? The breath we want is from the inside out, the diaphragm descends, the abdominal wall, which I view as being from the spine wrapped all the way around and back again, displaces and opens up in all directions. The pelvic floor can receive that, and that's transmitted through the whole tensegral body. The spine decompresses, the cranium opens. That's option one. When that's lost, option two, in order to get air into our body, is the person learns how to use the muscles on the exterior, the neck, the temporal muscles, the traps, the pecs, to try to pull the body open from the outside. It keeps the person alive, but it limits the distribution of the body, and it creates so much unnecessary tension because you've lost that inherent from the inside out.
I love it. It's such a deep explanation, and I love how you put it. So please, last question to you. If you can, at this point, explain connection between orthodontic treatment, guard, and body, or the services or treatments you can offer. How does it work with dental treatment?
Sure. So in an ideal situation, right, that whole respiratory mechanism I just described is going on. In order for that to go on, your brain needs to understand and appreciate that you have two sides, two hemispheres of the body. And to be able to alternate back and forth between the two. If I want to go to one hemisphere of my body and kind of stand there, which is that side compressing, so that side doing this kind of getting compressed, the other side decompresses, Okay, that's how we move around through space. In order to do that, my brain needs to appreciate the ability to occlude one side of my mouth from the molars up to the canines as the other side lets go. And then I need to be able to go to the other side and be able to compress that side and the other side let go. That ability allows the tongue to appreciate where center and neutral is. So I can teach the person how to sense and do that through the body. But if at rest, they have a bite that is patterned to a body that is limited in that, we can have a situation where the sensory feedback they get every time they close their mouth or every time they swallow pulls them back into that
Old pattern.
Old pattern, yes. Now, a lot of the people that come to find us, they are in a lot of distress.
Oh yeah, and it's visible.
And so if I had them be super patient and they're super diligent, a lot of this over time can figure itself out with the body biotensegrity approach. But why not use the assistance of something you can provide to, while I'm doing all of that stuff, put them in something where they can feel relaxed up here.
Mm-hmm.
And now you have the mouth that's no longer such a restriction to the body being able to open up.
This is so beautiful. Thank you very much. We really appreciate it. And I hope it will resonate with my audience and they find you. We're going to put your information underneath and they can learn from you. You know, you cannot say it's for everybody. It's for people who are curious,
Yes.
who want to live longer, to live healthy life instead of fighting with 5 chronic disease every single day. So it's a specific audience. I agree with that, but I like it's totally resonate with me, what you do. So thank you very much, Colby, for being so deep and diligent in your desire to heal us.
Thank you. Thank you.